checkups at the doctor are becoming more costly.
What's that feel like?
We have increased wages and rent, electricity, and that has been passed on to patients.
The fees causing headaches for some patients.
You shouldn't have to look at your bank account before you go to the doctor.
Certainly noticing the increases in prices.
Definitely gone up, yeah. And less doctors bulk bill. And there's lots around here, but hardly of them do.
The federal government is handing $3.5 billion to the states to ensure more patients can be bulk billed. Early signs show there's been a small increase in bulk billing rates, but many patients are still paying and more. GPs say that's because some states are introducing changes to payroll tax, increasing how much revenue they collect from medical practices.
General practices can no longer afford to absorb that tax on Medicare, and unfortunately for patients, the gap will widen and bulk billing will go down.
All we're really doing here is robbing Peter to pay Paul. It's a cost-shifting exercise.
We're really concerned about these reports that some of our historic investment in Medicare might be lost to payroll tax obligations and general practices.
The Treasurer urging states to work with GPs.
Listen closely to the concerns which have been raised by the College of GPs.
We are having constructive conversations with the GPs so we can properly understand the effect of all this.
But some of the states are arguing the federal government has a role to play too.
We are seeing a cratering of access to GP services around the nation.
They're demanding more funding.
There are many, many things that the Australian government could do to increase bulk billing levels, and none of them involve blaming the states.
Paying doctors more money so they can bulk bill more patients was a budget plan that received very little criticism during a cost of living crisis. But early signs are suggesting it's not working very well. And while the federal government can point the finger at the states and scold them for upping their tax take from GP practices, it's powerless to stop them. Stephanie Boris, ABC News, Canberra.